I'm here with my aunt, Alyssa. She is a
Physical
physical
therapist
therapist
assistant.
assistant. Can I ask how you got into this field?
I was always interested in the medical field since I was a kid. And I went to college at Oregon State University thinking about doing something in healthcare. So I was headed towards maybe nursing, took some classes there, and worked as a nurse's aide at a care home, and really liked the therapy side of things. So I kind of steered my career
Direction.
towards that. Yeah.
And can I ask what about what changes did you have to make to nursing to go into the therapy section?
Um, the the main classes were pretty much the same base of anatomy and physiology and just the main prerequisites, but to shift from to shift towards the therapy side of things, it was pretty focused in right on just getting right into therapy treatments. I'm a physical therapist assistant, so it's a pretty focused program on how to assist a physical therapist. So physical therapists can diagnose and make a plan for a treatment, and I will follow that treatment. So yeah, right, we got right into exercise and pain treatments, and yeah, it's a very focused program.
So, do you find it difficult to day to day?
There's different parts of you mean the job?
Yeah.
The job is, with any job, there's some easier parts and some more difficult parts. Different settings, I'd say, are more difficult versus other settings too. So I was in a skilled nursing setting with a lot of acute, very sick people, and that was a challenge. Now I've switched to home health physical therapy, so it's a little more laid back, and our people aren't quite as acute, so I wouldn't say it. Yeah, in some ways it's easier, but in some ways, the logistics of getting to someone's house and managing your time, that can be kind of difficult. But a lot of our patients aren't quite as ill or acute, so a little easier in this setting, I'd say.
You deal with you used to deal with car crash victims a lot, right?
Yeah. I have.
Was the emotional strain a lot at times? Can you go more into that?
Sure. Yeah. I feel like I could compartmentalize pretty well, so my emotions didn't get the best of me too often. Once in a while, there would be somebody who just, you have empathy for somebody who's really in pain or really suffering, having a hard time. It's the people that had a hard time with it that gave me a hard time. So most of the time I was a cheerleader. Come on, you can do this. Let's get up. And they're seeing their progress in physical therapy, and it's really encouraging to them, and it's really exciting. I guess there was a lot of emotion when somebody wasn't getting better, or somebody was so injured that they weren't recovering like they'd hoped they were. There's a lot of emotion there. Just kind of, you see they're grieving that they're not going to be who they used to be, or they're not able to do what they were used to be able to do. So you really see them grieving with that, and you have to try to, work with them and try to motivate them through that. And But yeah, so there is a lot of emotion at times with those kinds of situations, or somebody who's terminally ill. We work with these folks as well, so that can be hard. Hmm.
So, would you say that you saw a lot of patients like that often, or was it just like a rare occurrence in this field?
Oh, like terminally ill
Yeah.
people. I've seen a lot of death. I've really honed my education and career into geriatrics, so see a lot of the older population, and a lot of them. I have seen a lot of end of life. Mortality is something that they're thinking about and dealing with in this age group. So yeah, I have worked with that a lot, and personally, I think everybody's different. But again, it was kind of how the patient was dealing with it. If they're having a hard time knowing that they weren't going to be around much longer, or maybe if they were younger and they just felt like it wasn't their time, that I did have a harder time with that. But when you're in this field, and maybe especially with the older population, they just it's kind of a topic that they're comfortable talking about. A lot of people are at peace with end of life, so it just case to case, every person's different.
And when you were doing the nursing with the older patients, was there like one that especially like helped you like switch over to physical therapy, or was it just the whole experience as a whole?
I think it was the experience as a whole. Honestly, I really like the medical aspect of everything. But honestly, nursing and the medical side of things can get kind of intense, and I never minded blood or anything like that, or giving shots. Needles never bothered me, but yeah, I just I at that point I had kids, or I had one child when I was trying to make a decision, and it just felt like the right fit to the stress level of physical therapy versus nursing. So that honestly was a big thing that I thought about. Just how much of the stress load am I ready to take on? And other things came into play with that, like availability of schools, and nursing was very competitive. Physical therapist assistant at the time wasn't quite as competitive, so that came into play as well. But yeah, different factors. Just how am I going to manage life, career, and still like my job in healthcare without burning out too bad.
Did you feel like your classes, like, you had a lot of burnout? Like, I hear a lot of my friends that are going to the medical field and nursing, I hear they have a lot of burnout.
Yeah, when I was a nurse's assistant and I was focusing in on pre-nursing classes, there definitely was burnout. You get, a lot of, when there's people that need you and need help and are in pain, they're not always very happy. And it is, like, it can be exhausting. It takes a lot of self-care. It takes a lot of, coping skills, and just realizing that, these people need you, but you gotta be able to take care of yourself as well. So yeah, my days as a nurse's assistant, it was pretty exhausting, and I think I definitely had some feelings of burnout then, which might have also helped me think more about physical therapy versus nursing at that point as well.
During the beginning of your job as a physical therapist assistant, how did you enjoy it? What were the struggles like?
I really, really enjoyed my patients and just helping them learn. And I'll pause it for a second. Sorry.